So I believe we are now recording. Yes. So thank you everyone for joining us today. So with us on behalf of NHFT, we've got Sonia Bezic, who's the Work Experience and Functional Skills Lead from the Trust, who will be talking to you about the apprenticeship elements today. And then we're also joined by Roshni Khatri and quite a few of our colleagues actually from the university. Roshni is one of our partner governors here at NHFT, but she's also in her day job the Associate Dean for the Faculty of Health, Education and Society at the University of Northampton. So there are two main presenters today, but I know both of you have got additional speakers to join you. So without further ado, let me just get your presentation up, Sonia, and then we will start with your presentation. I nearly forgot I was sharing it then, even though I just literally mentioned it.
And just interjecting, Tracy, in terms of how we're planning for this to work, I'm right in saying that we're going to have some presentations and then take questions afterwards. Is that right? Yeah, so we'll take questions after the two presentations, if that's okay with everybody. What we've also tried to do is incorporate the answers that have come through in advance into some of the presentations. So hopefully some of your questions will be answered through the presentations, but if they're not, feel free to ask them either through the chat or by raising your hand later in the session. So let me just get your presentation up, Sonia. So that should now be showing, is that correct?
Yeah, that's excellent. Thanks.
Yeah. Do you want me to move to the first slide?
Yes, please. Brilliant. Okay, well, thanks for having me, Tracy. As Tracy has said, my name's Sonia Beswick. I work with the apprenticeship team at Northamptonshire Healthcare NHS Foundation Trust, and part of my role is about engagement. So engagement with the schools, students, colleges. I go out and talk about NHFT, apprenticeships and careers just in general in the NHS. So that's why I've been invited today. So basically, I'm going to talk about the apprenticeship pathways within the trust that we have at the moment, and how that works, how you would recruit to that, etc., etc. So we have at the moment just over 225 apprentices with the trust that are undertaking either a clinical or a non-clinical pathway, and the next few slides I'll explain the difference between the clinical and the non-clinical. Most of them, however, at the moment are within staff who are already working within the trust. So it could be our healthcare assistants want to go on and do nursing degrees, and they are actually with us already. We do employ new starts, so people that apply via NHS jobs for an apprenticeship post within the trust. I have brought along today two apprentices who are going to sort of just explain to you their journey as to why they decided to come and work for NHFT and what their actual journey was like through that recruitment process to work with us. So I've got Tamima Islam, who is our business administration apprentice, and I've got Ashley Mikhail, who is our occupational therapy apprentice. So once I've finished, they'll be going on to talk to you about their journeys. So within NHFT, as I say, we advertise. Everything's done through NHS jobs. Everything's advertised on there. It would be the same for a substantive post or an apprenticeship post. The application is exactly the same. You have the interview process, the shortlisting and interview process. With our apprenticeships, they do range. We do from levels 2 right through to level 7, which is the masters. So we have staff undertaking the level 7 masters with us, and those that are working towards perhaps nurse degrees or physio or occupational therapy will do their level 2s, their level 3s, and their maths and English. So because maths and English is a requirement to undertake perhaps your nursing degree or a level 5 and upwards. We do our maths and English through our functional skills, and we have a provider that we do that with as well. So you don't necessarily have to have your maths and English when you join NHFT. We have that support there to guide you through your maths and English to help you get through to your development and then help you step on to that career pathway, which may be down the apprenticeship route to get your qualification at the end. The SAFE or nursing, it's exactly the same qualification that you come out with at the end that you would get if you went to a university full time. It's a little bit longer if you do the route with us. It's 4 years with us, whereas it would be 3 years if you do it through the university. We pay you, and we pay for you to undertake your qualification if you do it through the apprenticeship pathway. So if you're a member of our staff, you would get paid, and we would also pay for your degree if it's that level that you are doing. But any of the apprenticeships are paid through. We have a levy fund that we have to pay each month, and all our apprenticeships are paid through our levy fund. You also will gain that hands-on experience because you'll be continually applying all the theory that you've learned into your practice while you're working with us, because you'll have a 5-day a week. It may be that you do 3 or 4 days in your job role and 1 or 2 days as your study day for your apprenticeship. So while you're working with us, you would still be getting paid, still be getting your annual leave like all the other members of staff. You would just be studying towards an apprenticeship at the end. They range from 18 months right up to 48 months, some of them dependent again on the level that you do with us. The eligibility for an apprenticeship is you must be a resident in the UK for 3 years. So you have to be that resident. And all I would suggest that if you have any queries regarding visas, etc., and are you eligible, I will send across to Tracy. We have a link that would be worth just for you just to go on, and it tells all about the visas and the remits and the eligibility pathways. But I wouldn't don't use that as a barrier to apply. Please still apply, because once you get through to that recruitment process, that's all checked for you. But obviously any queries that our recruitment service are very, very happy to discuss that with you. But yeah, I would suggest that I will put that link in so you can do that. We do have vacancies that are live at the moment on NHS jobs for healthcare assistants. That was one of the questions that was asked, and we do have a couple that are live actually at NHFT, and we use our healthcare assistant route as a pathway into our nursing degrees at the moment. You would come in as a healthcare assistant once you've done your probationary period. If you've got your maths and English and a level 3 qualification, which you can also undertake with us, you can then apply to do your nursing apprenticeship with ourselves. That's likewise for occupational therapy or physiotherapy or podiatry that we've got, or pharmacy, exactly the same. You would step in as that healthcare, and then we would then guide you through what qualifications you would then need to be able to step on or apply to do the degree in your chosen subject. I'm just thinking, I think, that's probably the most of the main sort of information regarding apprenticeships. I don't know whether you just want to go on to the next one, Tracy. So this is random. This is some clinical apprenticeships that we've got staff actually undertaking at the moment. So I've split it between clinical and non-clinical. So this is just a range. So we've got pharmacy technicians, nurse associates, obviously dietitians, advanced clinical practitioners, and these range from level 3 right through to level 7. So we've got staff undertaking these as we speak at the moment. I don't know whether you just want to go on to the next one, Tracy. So these are our non-clinical apprenticeships. So these are the different ones that we've got staff undertaking. There's quite range there, from quality to cyber security. We've got our senior leaders masters, which is our level 7. We've got operations departmental manager, data scientist, team leader supervisor. So again, these are also from level 2 right through to level 7. This isn't an exhaustive list. There are lots of apprenticeships out there. It's just that these are ones that myself and the apprenticeship team may look through, and we might think that might be relevant to staff roles within the trust, or it might be that services have come to us saying they're looking for X, Y, and Z. So we will then go on and have a look to see if there's apprenticeships that we can perhaps train out, develop our own staff that we've got to sort of like go up that ladder, or whether it can be what we class as a new start, one that we'll advertise externally for people to apply and undertake their apprenticeship with us to get them on that ladder to then go up that ladder for they'll then become a member of staff with the trust. Okay, so I'm going to say I'm not going to do questions. If there's any questions, we'll do them once Roshni's done hers. But what I'll do now is I'm going to hand you across to Tamima first. So no particular reason why Tamima, but I just thought I'd hand you across to Tamima, who is our business administration apprentice. She does work with the apprenticeship team as well. So just perhaps for her to tell her perhaps the whys, why she did it, what her recruitment process was like, the sorts of things that she had to undertake, what the interview process was like, and obviously then getting on board with us. And she might just sort of explain what she's been doing with us. She's been with us since the summer, so she's relatively new to us, and her thoughts. And then again, we'll move on to Ashley, who's our occupational therapist, who is very new. She's only been with us a couple of months, so she'll do sort of exactly the same. So we've got one from a clinical background and one from a non-clinical background. Okay, so I hand across to yourself, Tamima. Thank you.
Well, can you hear us, Tamima? Or you might be on mute. We seem to have lost you. Do we want to go to Ashley first, and hopefully we can... Oops, you're on mute. Sorry.
Yeah, do you want to go first, Ashley, and then obviously Tamima will join us. She's disappeared.
Yeah, that's fine. Hi everyone, my name's Ashley Meikle and I am a first year occupational therapist. I currently work on a female psychiatric intensive care unit here at the Welland Centre for NHFT. I decided to do the apprenticeship purely because I was in a previous role as an occupational therapy assistant in a trust in Cambridge. I had staff that had worked here that had moved to us that said it was a great trust to work for. So I applied as an external candidate for my apprenticeship here. I have been here since the summer and I am absolutely loving my role. I love the team here and I love the trust, and it is a really great place to work. I can't recommend it enough. My recruitment process was a bit more complicated than an internal process. So I applied externally through Track Jobs. I put up a document just to basically say why I thought I was good for the job, how I met the job description, what my skills were, my experience, and stuff like that. Once I'd been accepted for the interview, I had to send off my certificates for English and Maths to the university, and I also had to write them an essay to see what my skills were like. For my actual interview assessment for my job, I had a whole day's interview. And so I went and I had a first interview with the head of my team and 2 other occupational therapists in my team for the morning. I then had to prepare an activity to show how I can support service users in their recovery. For the afternoon, I had to do a written assessment to understand my writing skills, and then I had to have an interview with the university for the day. And then from there, the recruitment process was pretty easy with DBS and stuff like that. I really enjoy occupational therapy. This is what I've always wanted to do. And NHFT sort of gave me really the stepping stone to becoming from a assistant to a practitioner and being a qualified. And I absolutely love it here and wouldn't work anywhere else now. So yeah, that's me. Thank you.
Excellent. Thanks, Ashley. We'll hand over to Tamima. She's back in the room now, so she can just explain a bit about her journey and why she chose what she chose. Thanks, Tamima.
Hi, sorry, my network went out earlier. Essentially, I obviously do a business administration apprenticeship, and I came straight into this apprenticeship through from sixth form. So I was a sixth form student before it, and initially I wanted to go into the NHS. So when I came across this apprenticeship role, I was like, you know, I might as well apply. I'm going into the NHS. I didn't have many knowledge about what the NHFT was. You know, I wasn't aware of it initially until I applied. So when I did all that research, I was aware of like the community, that the trust is, and the amount of like mental health support and all the facilities that they provide in Northamptonshire. For the business administration, why I applied specifically for that apprenticeship, simply because it's something outside of the studies I've done in sixth form. I've always had a clinical approach to my career pathways, if you like. And so going for a non-clinical approach really like put me out there into looking at the different pathways that there are out there. I wanted to become a midwife initially, so going into this is completely different. But it really like showed me the other side of NHS, what the non-clinical jobs are and roles are, and what people do in like the executive or like admin departments, and what they do in those roles. So yeah, that's pretty much what I do and why I applied for this role.
So thanks, Tamima. Do you just want to move on to the next slide, Tracy? Thank you. So what I've put up here is just a couple of useful websites. So I know, like a bit like Tamima, perhaps wanting to go into the NHS, perhaps not quite sure, even though she thought she wanted to be a midwife. But obviously she's now with us, which is good for us. These are a couple of Careers Academy and NHS Careers. So obviously there's 350 job roles in the NHS. So these Careers Academy and the NHS Careers websites have them all on. You can go on, you can click on the links or use the QR codes, etc. And it will bring all that information up. If you're not sure, there's quizzes on there that you can undertake, and it might then guide you to the different ones from your answers. It might say, actually, you might be interested in doing X, Y, and Z. Or if you know what you want to do, you can go on there and find out a lot more information about it. The NHS Careers website, you can actually download books and things like that. It will give you all the information, true life stories, etc., of how people got into the roles that they're in and the different pathways that there are to actually get into those job roles. Okay, and I think that's it for me for the moment, unless obviously there's any questions once Roshni's done her presentation.
So we'll hand over to you now, Roshni, if you're ready.
Thank you. I'm just going to get my presentation up. Could you perhaps just tell me when you are able to see it?
We can see it.
Not showing full screen, Roshni, but we can see it. But it's showing the sort of the view where you can see all the slides rather than just the single one. There you go.
Just wondering.
Yeah.
Is that okay now?
Yeah, it's fine.
Brilliant. Thank you. So, yes, thank you for giving us this opportunity to talk to you about the courses that we offer here at the university. I'm joined by my colleagues Jane, Alex, and Chrissy, who can answer questions related to occupational therapy, nursing, and physiotherapy. But again, I'll go through and explain to you all the other programs that we have available here. So at the university, we sit within the Faculty of Health Education and Society, and we offer programs like nursing, midwifery, podiatry, paramedic science, occupational therapy, physiotherapy, psychology, sociology, social work, and education. So there's a wide variety of programs. And of course, within psychology, sociology, social work, education, there are further programs within those offers. Those are just the big heading that they come under. So we are really lucky to have our beautiful waterside campus, and basically we have a very different learning and teaching approach. We study in small interactive group sessions, and all of our teaching is enhanced by the latest developments in technology. We have stepped away from those big, massive lectures, and that's why we think it's a lot more beneficial for students to study within small groups. Our Learning Hub is the centre for our teaching sessions here at the Waterside campus. And basically, the Learning Hub has all the resources, the staff, and the learning spaces that you require to study. And it's also been designed to give you that personalised learning approach. Within the Learning Hub, you have access to your library, your field services, your lecturers, your books, etc. So everything is based in one area. Okay, so what do we actually offer here at the university? First of all, you can study anywhere. I'm just going to go back one. So all that are eligible for full-time undergraduate students can study with us from September 2024, and whoever studies with us will get a free laptop. So because all of our teaching is enhanced by technology, we didn't want to make the assumption that everybody has access. So to make sure that we give everybody the opportunity to study, all our students, undergraduate full-time students, do get a free laptop when they join our programs here. And I'll come back to that in a second. Yes, James just reminded me that our apprentices don't get laptops because actually they're employed by an organisation and they don't come through the traditional route. But you can always ask me questions about that when we come to it. Also, one of the positive things here at the university is all our sports clubs are free compared to other universities. And again, any of the books that you require is available online through our library. So you don't actually physically have to come in to access your books, or you don't have to purchase your copies. They literally get delivered to your laptop when you order it through the library. One of the other things that we have here at the university is our Northampton Employment Promise. So if you don't have a job within 12 months after graduating, but you have completed a Changemaker program, and all our students have access to our Changemaker program here at the university, we'll then find you a paid 6-month internship as part of our promise. And that is something that is value added here at the university. Okay, and of course, if you have studied with us previously, all our master's programs, all our alumni who have studied here get 20% off any of our master's programs, and that's worth noting because that is a significant sum of money. Okay, and of course, the website is available for you to access if you need any more information. One of the other things that I think you'll find really interesting is our approach to interprofessional education. And NHFT is an organization where people don't really work in silos. You work together with different professional groups. And that's the ethos that we have here at the university. So throughout your program of study, you'll be given opportunities to engage in interprofessional education with students from other programs in health education and social care. So we start that journey really early because we think it's important to start it at university so that it becomes normal practice by the time you go into the workplace. Okay. And of course, all our health programs have placements. And some of our placements are local, while others might require our students to live in or travel to them. But of course, there is financial support if that is required in order to supplement travel. We have a very good range of traditional and contemporary placements, and we try and make sure that our students have the opportunity to experience placements in a variety of settings if it's relevant to their programs. So, for example, in occupational therapy, physiotherapy, we would ensure that our students have experience of placements within a physical environment, a mental health setting, a social care setting, or even in a third sector setting. So if you think about all the different organizations or areas within NHFT, they might have access to placements within a variety of areas. And of course, the funding's being made available from this academic year to ensure that if there is potential, all our students have an overseas placement or an overseas experience. Because we think it's important for our students to see their professional all their professions within different settings. And if you go over to an international placement, you will see how your profession works within an area that is not familiar to you. So we hope that all our students have that opportunity. Okay, so again, for all our undergraduate students, your application is through UGAS. And of course, if you are interested in an apprenticeship, please contact us directly because that's a different application route. Our applications are screened by our admissions tutors, and we have 3 of them here today. So please do ask lots of questions when you can. Most of our courses have an interview process, and that includes a one-to-one and or a one-to-one interview or a written activity, which is often submitted in advance. And we also strongly recommend that you visit a number of departments in preparation for your application, so that you know more about the profession that you're going to move into. Okay. Our courses are very competitive because we get applicants from a wide variety of areas, including international applicants. So it's really important to write a really good personal statement. And of course, if you come to one of our virtual open days or one of our face-to-face open days, there is a specific session that helps you prepare your personal statement. And of course, your statement should, for example, if you want to apply for occupational therapy, physiotherapy, state why you desire to study that particular profession, as well as nursing. You know what the profession is about, and any work experience or voluntary experience that you've done. It's important for you to state that in your personal statement. And don't forget to include any of your personal achievements, because that's really, really important. But again, there's support on our website as well as through the open days where you can ask more questions about your personal statement. There is some funding available, but there might be some additional costs. So, for example, students may incur travel and accommodation expenses, but they can claim them back. In terms of our uniforms, we will provide all our students with 2 tops and 2 pairs of trousers, but additional uniform items can be purchased if they are required. And of course, you are eligible to apply for a means-tested NHS bursary. So again, please ask that question when we come to the question and answer session, because there are bursaries available for some of our programs. Okay. So that concludes our presentation, and yes, please do feel free to ask questions when you can.
Thanks, Roshni. So, do we have any questions anyone wants to ask? If you could either just raise your hand or add them to chat. So, is there any immediate questions anyone wants to ask?
Tracy, I've got some answers to some of the ones that we were given before. I don't know
yes, good idea. Yeah.
So obviously, some people asked about age. So how old could they be to come and work at NHFT? Now, the minimum age is 16. So we have taken on staff at the age of 16, but it's very limited, obviously, the areas of where they can actually be placed. Mainly 18, obviously, because of the mental health wards and services that we've got, but we do take from 16 years of age. We have appointed some apprentices previously. We haven't got any at 16 at the moment, but they were 16, 17, so GCSE age, so they can come from GCSE. They don't have to undertake their A-levels, because they can do the level 2 and level 3 qualifications with us. So that was a question that someone sort of asked about, how early can they start with us as a trust. Someone's got their hand up. Oh, yeah. Someone's got their hand up.
So, Mr. You've got a question that you want to ask?
Good evening. Can you hear me?
You can.
Yep.
Okay, so I had sent a question in the chat room. I'm working as a support worker, right? And I'm really interested in becoming part of the NHFT, but I'm under sponsorship with another company that I'm working with. So my question was, do I have to wait until the period when my sponsorship is done, and then I'll be eligible to start with the NHFT, or I can do that even before? I'm quite clear. That's my question.
Yeah. So that is a recruitment question, Mustafa.
Oh,
What
yeah.
I will do, I will find out the answer to that question because I've written it down and we've got it in the chat. And I will speak to recruitment and get that answer, and we'll make sure that you get the answer to that question.
Thank you so much.
We don't have anybody from recruitment here today.
All right, that's
yeah. I've written it down. That's not a problem.
Okay, so all right. How can I get the answer? You're gonna answer later, is it?
We've got your contact details, so we should be able to send it through to you.
That's okay. Thank you.
I think we've just had another question through in chat. So the question is, let's read that. So but I'll read out the full statement just for everybody. So I've done my undergrad in pharmacy in India and also a registered pharmacist. I'm pursuing an MSc in public at the University of Northampton to work as a pharmacy technician. So I'm guessing they're asking what the route is into the NHS. I don't know if anyone wants to take that question specifically in the chat.
So I can obviously we do have pharmacy technician apprenticeships. So we have got staff that are, and they are new starts. So and I do know that they are looking at putting out 2 more. It's just got to go through panel, etc., etc. So it could take a couple of months. It could be after Christmas, but I do know that they are looking at advertising 2 more pharmacy technician vacancies that will be going out again on track, because everything goes obviously through NHS jobs, and then you apply via track. So the answer to that question is I would perhaps register onto NHS jobs, because it can email you and alert you when these posts become live, and you can then apply for it. Does that answer your question?
Yes, thank you for answering. But then I was wondering if we have to write the exam called GHPC registration exam. Should I write the GHPC exam, which is from UK's registration for pharmacist?
Yeah, I can't answer that question, I'm afraid. That would be a question down to our pharmacy, our pharmacists that we've got. What I can do is if you put it in the chat again, same as so I can get that answered and we can reply back to you.
Yeah, thank you so much.
So we have had another question, which is, how do I join the trust immediately after my nursing course? And can I join now even before I graduate? So I don't know if that's another one for you, Sonia, or somebody else.
Say that again. So they're undertaking.
So they're currently doing their nursing course. So can they join the trust before they graduate, or basically how do they get into nursing through sort of in NHFT once they graduate? So it's 2 slightly different questions.
Yeah. So obviously you're still training to be a nurse, as I've gathered from that question. So you could apply, but you wouldn't be able to apply as a qualified nurse because you're not qualified technically yet and you don't have your PIN. So we do, as I say, all our jobs are advertised on NHS jobs. So once you are qualified, you could then apply via NHS jobs to come and work for us as a qualified nurse, because you'll then have your PIN, because obviously without that you won't be classed as qualified. And so obviously when you apply, you could put that you are studying, but it just really depends on that service as to whether they will wait until you've qualified or whether they're looking for someone to start sooner.
Thank you.
So we've got another question from Maisie, who was just sort of really asking for clarification, I think, about the roles that are being advertised, because she's mentioned that she can see a regular Band 3 healthcare assistant role being advertised, but it's not specifically shown as an apprenticeship. So I don't know whether you can sort of clarify that, Sonia.
Yeah. So the ones that are advertised at the moment are not apprenticeships. They're substantive healthcare support workers. That doesn't mean to say that you can't undertake an apprenticeship with us. So if you're successful and you start as a healthcare assistant, if what you would like to do is to then develop yourself further and your end goal is to become a registered nurse, once you've done your probationary period with us and everything's okay, you can then, through your appraisal and through your supervisions with your manager, say that this is what your end goal would be. You would like to be able to become a registered nurse. Through your development then, dependent on what you've got, if you've got your maths and English, brilliant, you won't have to do that. But if you haven't got the level 3 qualification, you can do that with us as an apprenticeship. You can register with the apprenticeship team to undertake that. When your manager has to sign it and your service manager has to sign that off as well as part of, because you are part of a service. But you can do that with us. Just because the job role doesn't actually specifically say apprentice, it doesn't mean to say that once you are, and if you're accepted in with us, you can't undertake one with us.
Thanks, Sonia.
Yeah.
There's a slightly additional bit to that question, which is I think what it's asking is, once someone's sort of done their healthcare assistant sort of apprenticeship, how long would it then take them to maybe progress into the nursing apprenticeship?
Yeah. So as soon as you've got your level 3 qualification and you've got maths and English, you can apply. So we do 2 engagement sessions a year. So we do one at the beginning of the year, so it'll be January, February next year, for commencement in September. And then we also do some in September for commencement in February, because it's quite a long sort of like recruitment process. So as long as you've got what's required for the entry, you can apply. We do get lots of people apply. It might not be that, you know, it might not be the time, you might not be successful, because as well as having interviews with us, you also have to have interviews with the university as well. But yeah, there's no sort of like, you can't do it, you've got to leave 6 months to a year after you've got your qualification. You just have to do your probationary period with us first, which can range between 6 to 12 months before you can then apply to do either your level 3 or your level 6, which is what your nursing degree is. We've got staff that are just done their maths and English with us and are now starting in February next year. So there's no sort of deadline. As long as you've got everything before that commencement, you can apply whenever.
Thanks, Sonia. We've had a question about visas. Now, I think we did say a bit earlier on that we'll provide the information in the follow-up email. And we can also, if it's a specific question, we can sort of ask our recruitment team if they've got any additional information on those questions. And that's probably for the question about the registration. So that might be a question we need to take offline and ask and get back to individuals afterwards. So we can see your name in the chat and we should have your contact details on the booking, so we can get back to you on those ones. So Maisie has also asked another question actually about, she's registered oral surgery dental nurse, and she's sort of asking if she can progress from this role. So I don't know if there's if you know that much detail about your apprenticeship, Sonia, or whether that's one we would need to also
I don't know, obviously not all of them, because there's that many there, the pathways, there's so many different pathways. We do have a dental one, so it's something that obviously I could say, if you've got this, we can look into that, you could do this, and then there's this, and there's this, and there's this. But yeah, we can get back to Maisie on that.
Yes, we've got another question here, someone who's been volunteering with the Recovery College and some of our networks, and they're asking generally about how they find a job. Now, I'm going to presume that's NHS jobs again, Sonia, in that side.
Whether it's an apprenticeship or like a healthcare assistant or a therapy assistant, all our jobs, not just us, you know, NGH, KGH, they're all advertised on the NHS jobs website, and you can be quite specific and filter that down. If it's something you're just looking for in Northampton or Northamptonshire, you can be quite specific on there and it will list everything that's up there. We don't have deadlines of this is when we're going to be advertising this and this is when we're going to be advertising this. It could be any time throughout the year. It's a bit of a roll on, roll off. It might, apart from the ones that are the higher level ones, as we class as like your degrees, etc., they work around the academic year. So you'll have an intake in September and an intake in February. So they're usually around the beginning of the year and around September that they'll be advertised.
Yes, and we do advertise all our jobs on our own website, don't we, as well, Sonia? So through the actual NHFT website.
Yeah, you can go on there
and
they'll all be advertised on there. If you go click on the work with us, they're all advertised and they all take you straight across to track.
Tari's put in here about she's a qualified children's social worker looking to transition into work with adults. So I presume your question, Tara,
I've got that question.
There you go. I'll let you answer that one then, Sonia. So, it's like you're prepared.
Yeah, so I did see that question come through. So as in the trust, we don't have our social workers, as in NHFT. That's like our local authority. So that's our council. So West Northamptonshire, North Northamptonshire, local authorities that the social workers work for. However, we do have a looked after children's team and we do have a safeguarding team. So obviously, but the social workers don't sit within those teams. They work with those teams, if that makes sense. So it might be the local authorities, might be the signpost for that particular person, perhaps to get in contact with, to ask the question about transitioning from children's to adults social work.
Sonia, there's a question about funding. I'm not sure that's apprenticeships or university funding. So the person just asked that question, just confirm if it's the apprenticeships or university or is it both that they're asking about, just so we know who to direct the question to. Just checking we've got any other questions while they're doing that.
I can answer for apprenticeships if just in case, and then Roshni about the funding for the uni. So apprenticeship funding, so if you undertook an apprenticeship with us, there is no cost to yourself to undertake that apprenticeship. So NHFT, we have to pay a levy each month to the government, and this apprenticeship levy is what we use to pay for our staff to undertake the apprenticeship training. So there's no cost to yourself. The funding is all paid through our levy. That's for an apprenticeship.
Thank you. I guess from the university perspective, Chrissy, would you mind talking about funding from a nursing student perspective?
Yeah, so obviously if you're going down a traditional route and applying without the backup of an apprentice, then you are required to pay university tuition fees. So I believe they're just over 9,000 a year for a UK student. International students are sitting, I think, around 15,000 a year, and that's for your tuition. But obviously, as Sonia mentioned, the apprenticeship route would cater for that. If you went down that. And so I think most courses are similar. Obviously, the 4 fields of nursing that we offer all have the same cost, so it doesn't cost more to do one or the other. And they're paid on an annual basis. In terms of costs, help you, as Roshni mentioned about placements. So again, if you are a kind of home student or a European Union student, you get the Learning Support Fund, and that is a tax-free bursary that you don't pay back, and that's given to you, and that's to help you get to placements, that's to help you with travel costs throughout, and that's paid each year. International students aren't necessarily entitled to the Learning Support Fund, but again, there is additional money that can be awarded for travel. So that's something new that's only come out within the last kind of 12 months. So I think with the increase of international applications, but we have a whole team dedicated to helping, not just with finance, but for finances for placements as well.
Thank you, Chrissy. Alex, Jane, would you like to add anything more to that in terms of funding?
No, I think it's the same throughout from all the health courses, that if you're eligible for the NHS bursary and have additional funding, then if you need it for placement and travel, it is worth being aware that for placement and travel you may have to outlay and then claim back in some instances, so it is worth bearing that in mind.
Thank you.
Echoing what Chrissy and Jane mentioned, it's all applies as the same to physiotherapy as well.
We have got an additional question on the funding here, but are apprenticeships government funded? Sonia, you might, I hope, know or might know the answer to that one. So.
Yes. So say it's government funding, it's technically it's NHFT's money, and then based on our headcount each month, we pay the government take so much and put it in a pot basically, and that pot we can draw down back to NHFT to pay for our staff or new starts to undertake an apprenticeship. It's specifically only for the apprenticeship. The funds can't be used for anything else. It's just the cost of the apprenticeship. So technically it is government money because it goes to the government and then it comes back to us. We have to draw it down each month to pay for them.
We did have a question in starting about somebody was looking for advice on how to become an assistant psychologist. So I don't know whether that's a university route or that one, or that's one we might need to come back to.
I will probably get the answer and send it to you, because I thought our psychology admissions tutor would join us, but he hasn't yet, so I'm assuming he's still teaching. So yeah, I'm sorry. I will get a response for you and send it to you via email.
I think I've captured all the questions in chat, but if I've missed yours, please just highlight it to me, of course, because it's been quite a busy chat actually with people asking questions. I think of a question, Sonia, actually, for the apprenticeships, because you mentioned earlier that people can apply for like a normal band 3 job and sort of and they will then be able to do the apprenticeship. If they come in as a new starter, what is sort of the structure of their sort of salary in that circumstance?
So if they're a new start, not apprentice.
A new start, because they can come in as an apprentice, I believe.
They can come in as an apprentice. They can come in as apprentice, and that is at the moment, I think it's the bottom of what they would say a band 2. So it's in that band 2 range, the apprentice, and then obviously they then work while they're undertaking. It depends on how long that apprenticeship is. So that's if they're a new start. Yeah. Obviously, if they come in on a band 3 role, obviously they will then get paid, obviously their band 3 role. And what we do say to the staff is when they then undertake their apprenticeship, they still stay on the band that they're on. They don't drop down, because I think some staff think, oh, if I'm then going to do that, I'll then have to drop down to an apprenticeship wage. No, that you stay on what you're on basically while you undertake your apprenticeship.
Just a slight additional question, so Sonia, just because it's relevant to the news today. But is the apprenticeship wage paid at the sort of the minimum wage? Because I believe that has been raised today through the Autumn Statement. So I just thought, yes.
So that part of it, I will find that's a question, because I don't get involved in the wages side of it. That's Mick. I should have brought him along. He could have told you everything about how it works. And I know there's been a lot of discussions. I do know that Mick's been involved with about the apprenticeship wage and trying to get it to match across the county. So it doesn't matter whether they start with us or KGH or NGH, the apprenticeship wage is the same. But I will find out from Mick what the exact wage is that you would start at if you came in as an apprentice with the trust, and then what it would go up to, because it goes up each year. Okay, I'll find that out for you.
Richard, I don't know if you're coming in on that or you've got a brand new question. No, new question.
New question. It occurs to me, Tracy, that a number of people are probably thinking about putting in an application, or hopefully putting in an application for either an apprenticeship and or a course at the university, and might be thinking about any top tips that we might have for applications, what sorts of things to look for. I wonder whether either university colleagues or Sonia could dispense any top tips they may have for people putting in applications or thinking about making those choices.
For us, and it's one thing we do talk about when we perhaps go out and do our engagement events, is the supporting documentation, because everybody has to fill in the first bit, your academia and that side. And what we're finding is a lot of people, they have exactly what we're asking, And obviously we then have to shortlist that down. So what is it that we use ourselves to shortlist from, I don't know, say 60 down to 10, because it's quite a lot then. And it's that supporting statement that's really, really important for us. A bit like Roshni was saying about that experience, transferable skills, mainly, you know, what you do, whether you've had any work experience, what your hobbies are, if you've got a part-time job, what you do and how you can transfer those skills that you've learned into a healthcare setting. How can you do that? And have you perhaps volunteered in a care home or something like that? So we can just see that you've got that understanding, that caring. You perhaps know sort of how certain things work. We don't have expected you to have worked on a ward if that's where you're applying for and things like that, but just have that bit of knowledge and a bit of understanding. And we do give out, we have a sheet that I can give to Tracy of supporting statement documentation, perhaps a good one and a not so good one, of what the sorts of things are in there, so you can differentiate between the two, which I'll make sure Tracy gets before she sends that out. That for us is, you've really got to sell yourself. Sell yourself, tell us all about you, what you do, what you like, what you don't like, and how you could then transfer those skills into that healthcare setting. I don't know whether Roshni's got anything else.
I'm going to be a cheat and hand over to Alex, Chrissy, and Jane because they're the experts when it comes to personal statements.
Okay, I'll go first. So I think the main thing for us when we're looking at it from the perspective of occupational therapy, and I'm going to guess that my colleagues are going to say the same thing, is that you've taken the time to understand what the profession is about, and that your statement reflects your knowledge, interest and understanding in the specific profession. So if you're applying to be an occupational therapist, we would expect you to be talking about occupational therapy and how those lovely transferable skills that Sonia mentioned are applicable to occupational therapy. And likewise, I'm assuming that Alex and Chrissy are going to say very much similar in terms of nursing and physio. We want to know that you're committed to the profession that you're thinking of joining. And that's partly because you're committing 3 years and a lot of money, time and effort. And at the end of it, they are all separate, protected professions. And so if you want to practice as a physio, you have to have trained as a physio. If you want to practice as an OT, you have to train as an OT. Nurse likewise. You can't swap between those professions with the degree. So that's why we ask you to spend some time in advance thinking very carefully about what appeals to you about the profession that you're thinking of joining.
Thank you. Chrissy, Alex.
Yeah, just to echo what Jane's saying, obviously for nursing, we're lucky at the University of Northampton, we offer all 4 fields of nursing and also our nursing associate route as well. So for myself, when I'm reviewing applications, it's making sure you've specified which field, because as Jane says, you are qualifying in one of those 5 fields. So you can't, there are opportunities to work cross-field, but ultimately I'm on the children's register as a registered children's nurse, my colleagues on adult nursing, mental health. I think also when it comes to transferable skills and work experience, obviously we get a lot of young applicants that maybe panic at that point and think I've not done anything, but it's finding who you are as an individual. And even if it is just doing a bit of a mentorship at school or like some church groups or like you say volunteering, it's picking out that everybody has life experience prior to starting a profession, and it's just understanding and getting help in terms of shining and letting us know what that is. And finally, obviously being a professionally regulated course, we are, you know, not just here as a university, we have our professional regulatory body, so an understanding of what that means, what it means to be a professional, adhering to a code of conduct, for instance. That's all part of your background reading and research.
Thank you.
Again, what my colleagues have covered pretty much covers the equivalent for physiotherapy. If I try to offer something different in this direction. Well, Chrissy kind of touched on it at the end. Is I would say think about, you know, the profession that you're interested in will have, like Chrissy said, a registering body. There might also be a professional body. So for in the case of physiotherapy, that's the Chartered Society of Physio, CSP. And then alongside the Health and Care Professions Council will be the kind of main, I would say, resources online as well, where you can find out more about what your profession might be about. There might be some overlap with other professions there, but there will definitely be something that sets it apart. And if you're able to think about yourself in that situation, what sets you apart as a professional, and mention that in your application personal statement, would make it very, very sort of appealing and easy to see the future of it.
Thank you.
Yes, thank you. I feel like I need to build on Richard has put in chat about our opportunities for involvement within NHFT. So I feel I would be amiss, considering we are the team that have some of those opportunities for involvement, to not mention it. So I think it links to the people who have been volunteering that they might want to put on the CV or in their supporting statement. So there is a link there, and there's a variety of ways you can actually volunteer with the NHFT. So you can be a volunteer, and there's many opportunities there. So there's I think the link is in the chat. We actually have opportunities to become governors with NHFT. So if you join to become a member, we will send you details about how to stand as a governor, and we do have some seats in the public and service user and actually the staff constituencies for those of you who are staff on the call coming up early in the new year. So that's a good opportunity for people who might want to get experience within the NHS. There's also a team sort of called the involvement team, and they get involved in some projects where you can maybe both be improving services as well. So there's quite a variety of ways you can get involved that you might want to add to your CV, even if it's not a paid opportunity at this stage. So we can send details of that out as well with the catch-up. This is going to get quite a long catch-up email now, isn't it, when we send it out? But we can make sure you've got all those details as well. So I just thought I should highlight that because Richard had highlighted it. And I can see people are putting various links in the chats to the various professional bodies as well in there. So Darren Solar, I hope I'm pronouncing that correct, but you've got a question?
Yeah, just a few questions that I got from people who couldn't join tonight. Now, NHFT is a mental health trust. Now, there's a young adult who's looking to work with NHFT as an HCA, and she also wants to be a pediatric nurse. Now, is there a possibility of, you know, because definitely what she's looking at is work with NHFT for some time and then get the opportunity to get on the apprenticeship train and become a nurse. But can she become a pediatric nurse within a mental health trust? That's the first question. Then the second one, you had mentioned about employing someone who's as young as 16 or maybe done their GCSEs. What kind of role will be open to someone like that? Because I've also had a question like that. Thank you.
Okay, so the first one, they could definitely from a HCA role join to do nursing. Because paediatrics doesn't sit obviously under the NHFT remit. I know the nurses, ones that have just started last month with us on the apprenticeship route, they're doing most of them are obviously going down the mental health route as a mental health nurse. But again, I'm going to ask that question because obviously my colleague, she looks after them. She's their placement learning facilitator for all our apprenticeship nurses. So I will ask her if we have a member of staff that wants to do paediatric nursing. That's where her goal lies. Could she still undertake it with us? Chrissy may know the answer. I can see she's
I was just going to say, obviously, with the new Future Nurse standards, there is an overlap and cross-field learning within each of the 4 fields of nursing. So all of our students at the university are mental health first aid trained, and we're the only university in the country to offer that as well. And there is exposure and placement opportunities in areas like CAMS within that. Now, I think what they need to understand is, do they want to be a mental health nurse that works with children, or do they want to be a children and young people's nurse that has an interest in mental health? Because they're two very different pathways. And some people do come to me and they're very much like, I don't know where my heart sits. So I would say doing a bit of research about some of the roles. I definitely come across children and young people with mental health problems in my day-to-day kind of clinical world, but I'm not a registered mental health nurse. So it's a very different approach. So I think it is, like I say, whether they want to be a specialist mental health nurse that specialises in children and young people and have those connections, or becoming a children and young people's nurse that then has an interest in young people's mental health.
Thank you. That was really helpful.
Second question, that was about age, wasn't it? The second question, 16-year-olds. So in the past, we have employed 16-year-old apprentices. So they've mainly been in admin roles, so doing business administration like Tamima. However, we have had a couple on our community inpatient bed wards at Isbrook, Daventry and Corby, in there doing the healthcare assistant apprenticeship role within that service down there. Anywhere else it would be 18 years of age.
No, thank you very much.
Sorry, I was just typing an answer. I was just basically, if anyone's interested, that we actually in our team in the past have had two 16-year-olds. So then, yeah, one's I mean, that was quite a while ago now, but one's, I think they're both probably in their 20s now, but one is still within the team and one still works with the trust, I believe. Although I think she moved into a HCA role, actually, if I remember rightly. So, yeah.
Sophie.
Gemma. Her name was Gemma. Yeah, so but she joined us in an admin role, and I believe she moved into an HCA role. So that's an example of someone who did an apprenticeship in admin who then went over into a different role within the trust. So yes,
we've got a few of those. We had a couple that probably started with Gemma that did their business admin level 2, level 3, then decided to go and be a ward clerk. So went and worked on our wards, and then while they were there, they actually decided, I want to become a nurse. So then did some bank work, and then 2 of them now have just started their nurse degrees with us. So you can cross pathways as well. You don't have to stay on the same pathway. You know, there's the opportunity there, and that's the good thing about NHFT. There's opportunities for your development. If you want to cross pathways, you can. You know, there's secondment opportunities. You can shadow, you know, if you've got interest in another team. So yeah, it's very good for the development. You don't have to stick at the same pathway.
Sonia, I was just thinking actually while you were here, we've kind of drifted into just slightly different angle, but I believe you're responsible for work experience as well. So I presume for those that are maybe under 16, there might be an opportunity there as well if people are interested in working in the NHS.
Yeah, so NHFT offers a face-to-face work experience programme, and that's from 16 years and upwards. There's no top age range because it may be for someone that might want a career change. They might want to change their career completely and might want to just come and shadow our services for 2 or 3 days just so they can get that understanding. So that's still classed as work experience. It's not just for students and college students. It mainly captures schools and college students. Yeah, we have quite a robust application process that you have to go through. There's risk assessments, and you know, you get ID badges, placement plans. But yeah, I've got some very, very strong members of staff that offer this out. We've got dentistry, we've got physiotherapy, we've got occupational therapy, speech and language therapy, pharmacy. Dentistry is a big one that's just come up. We've got nursing. Our community inpatient wards will take 16-year-olds, and that's a 5-day placement for them to observe. They're all observational, so that's for them to observe the goings on a ward, and they will then observe whether the consultant comes on his ward rounds or whether it's on a DMT. They will meet the receptionist, the cleaners, they will get involved, they will meet the clients. So it just gives them that understanding of how a ward works. We also have business admin you know, if they want to come in and perhaps go and sit with finance, or they want to go on our receptions at our hospitals, yeah, that's there, and that's open to everybody. As I say, as long as you're 16, minimum age is 16, but it's open to everybody, and that comes to myself and Tamima, who's just started. Tamima now has just started helping me with that as well. So yeah, it's quite a robust one. So HEE that are no longer with us, the trust itself has got the bronze award for our HEE work experience process, which is very good, and we'll be going for our silver award next year, and that's for our process and our actual placements that the students undertake.
Thanks, Sonia. So it sounds like if people aren't fully sure what they want to do in their career, there's plenty of opportunities with NHFT to even just try out, I guess, what you might be interested in.
Yeah, we do professional talks as well. So if it's specific and they can't actually come into us, the professionals will contact them and have that career talk with them if that's going to help them as well. Oh,
did you have additional questions?
Yeah, just from what you said about I just wanted to find out with the volunteering and work experience, how does the application start? Does it have to come through? I mean, that can be tracked, can it? Or does it come directly to?
No, it will come direct to myself. Yeah, on our website, on the NHFT's website, there's a bit about work experience and the application forms on there. So they would fill that application form in, and then they would send it through to the work experience email, which again I will give to Tracy. This email is going to be very long, Tracy. I will give Tracy the email address for when she sends it out to you at the end. So you've got that. You can either go through the Trust's website, or you can just email work.experience and say that I'm interested in work experience, and you'll get all the paperwork sent back out to you in a standard reply that you can then complete and send in.
Thank you.
Yes, so I've seen someone else's query about the sponsorship. So these are some of the links we'll put in the email, and if we will ask our recruitment colleagues as well in case they've got any additional information. So we'll make sure that does go back out to you. So I think we've got another question here. I'm just checking I haven't missed one above it before. So just checking. So somebody's essentially querying, I think, what their career path would be. They've got a certificate of high learning in mental health. I presume that's UONG University of Northampton. So I don't know if anyone wants to sort of take that question. Or is that what we might need to come back to?
Yep. Yeah, I wasn't sure, Sonia. Are you going to answer to that question?
I would come back to that to find out what the certificate is.
Yeah. It just needs a bit of clarity in terms of what the certificate is, in what subject.
That's fine. We can liaise with the person who asked the question, and then we can get that answer back to them at the end of the session. Yeah. Is there any other questions anyone wants to ask whilst we've got all the experts in the room, so to speak? Since we drifted on to volunteering, she might not thank me for this, but I see we've got one of our staff governors in the room, Joanne. So Joanne might just want to talk about her experience as joining as a governor. I know that you're a staff governor, but we also have public and patient governors. So since we were talking about ways that you can get involved with the NHS, not necessarily directly employed, but as experience, I just wondered if you wanted to say a few words, Joanne, about the role as the governor.
Hi, Tracy. Yeah, just put a sweet in my mouth.
I actually clicked the wrong time that question, didn't I?
That's all right. Just to say, I would really recommend joining as a governor, because you really do understand. You get to understand how the NHS works from 360 degrees. You've heard tonight about all the different staff that the NHS employs. We talk an awful lot about frontline clinical staff, But as Sonia knows, all the support staff can't do anything without all the support staff. So important. It really is a team. Ash, you mentioned that you had come from, was it the Cambridgeshire area?
Yeah,
right?
I came from Cambridge to here.
You came from a neighbouring community trust, is that right?
Yes.
I too came from a neighbouring community trust, and can really advocate what a great organisation NHFT is. It's very supportive and very friendly, and I think you would echo that, wouldn't you, Ash? Well, you already have done. So being a governor, there's an awful lot to learn being a governor, and you sort of, as you journey through, you understand more about the role of the governors holding the NEDs to account. And the great thing, anybody can go and look on NHFT website, look at the reports that are all transparent and visible about what's happening in board meetings, lots of information. So I would really recommend have a go, meet lots of different people, lots of understanding. It transforms you as through the process. So, you know, I can't recommend it highly enough. I've learned such a lot. I've been working in the NHS for the last over 30 years, and being a governor has really enhanced my understanding. So back to you, Tracy.
Yes, thank you, Joanne. I just thought I'd get that in since we are involved in this session. So we sort of did touch on a lot of the voluntary opportunities, didn't we, as well as sort of the paid opportunities. So I think there was one other question. This might be another one we may need to come back to, but we've got a question from Gaynor, so she's a human rights lawyer in Zimbabwe with work experience in safeguarding protection, and whether there'll be any relevant work opportunities in NHFT. So I don't know whether, Sonia, that's one you can answer, or it's another one we might need to come back to.
I can't really sort of answer that to say, yeah, we're going to have this in safeguarding, etc. That would be to the team, to the safeguarding team.
Yeah, and I think, like we've said quite a few times throughout the evening, that NHS Jobs is probably the place to go to for any sort of jobs that have been advertised on our own website as well. So, and that will apply to our other local organisations in the sort of the system, actually. Kettering General and Northampton General, well, their jobs will be advertised on there as well. So as much as we want everyone to come and work for NHFT, there is other NHS organisations locally that people may want to apply for jobs for as well. So I just thought I'd mention that one. I think I've captured all the questions in the chat that have come up. So if I've missed anyone, can you just sort of raise your hand or just let me know? I think I've captured the ones that all said we will come back to them. So is there any questions that anyone wants to ask before we finish the session? Whilst we've got everyone in the room. Give anyone a minute if they're asking any questions. It doesn't look like we've got any more questions. So we are at 6:15. So 6:30 was the sort of target, not necessarily when we have to end. So we can give you all back 15 minutes if you wish to do so. As we've had lots of questions today, I will review the chat, make sure we've not missed any questions, and come back to you. We might try and theme some of the questions because we've had sort of a few similar questions. And we'll go back to individuals if you've asked specific questions as well. I will send out a feedback form as well for today. So please do give us feedback, see how useful you found the session. The recording will go on the website after it's been processed. So you can share this with anyone else who might be interested as well. So we'll give you the link, or I'll give you the link to the Trust website. So it might not be this week, it could be next week it's up. So if we've concluded, I'd like to thank Sonia, Roshni, and all of the speakers that have come from both sides, both NHFT and the university, because I think we've had lots of detailed questions here, actually, and hopefully everyone who's asked a question does join the NHS in some shape or form in the future. So, and also in a voluntary role as well, if you wish to do so. So if there's nothing else, I will let everybody go. Thank you very much for joining us, and have a good evening.
Thank you, Tracy.
Thank you.
Thank you very much for a very informative session. Thank you.
Thank you.
Thanks, everyone.
Thank you. Good
Bye.
evening.
Thank you, Chrissy. Thank you, Alex.
Thank you very much.